It's time to check in with Derek McNally, the Executive Vice President of Clinical Services and Chief Nursing Executive of Niagara Health. And Derek, I missed you last week. We didn't have a chance to check in with you last week. We did have Dr. Sang in, and she was fantastic, but I really did miss you. How are you?
Great. I miss you as well, Mike. Doing really well. Had a nice break for Canada Day with the family, and so, as I'm sure everybody did. So yeah, and here we are back to business again.
What is the volume of visitors to the hospital since you opened up visitation?
So, we were so excited to open up our doors to visitors, and I'll tell you, Mike, I actually went downstairs to welcome people on that first day, and people were just so thankful. Our patients were hugely thankful. The staff and physicians were thankful to get the visitors and relatives back in, and so we're continuing to do the one visitor per patient. We continue to have our visiting hours from 11:30 to 1, and then from 5 till 6:30. Patients are getting screened as they come in the front door. They have to wear a mask, just all of those things that we talked about before. But it just was fantastic, and it's made such a difference to the patients.
2 weeks ago, when you and I spoke, the assessment center in Welland was fairly new. It had to be closed, obviously, for Canada Day. I just would like to know, has the number of people being assessed in Welland, has that increased as you expected?
It continues to increase, not in huge amounts. The overall number of in our assessment centres. So, for example, we saw 10,000 patients came through for screening in June alone. A total of 25,000 since we opened the assessment centre. So the numbers are stable and steady at Welland. We'll continue to run the assessment centre at Welland Monday, Wednesday, Friday for those business hours that we've advertised, and we'll continue to keep an eye on it, Mike. As if the numbers do go up, then we may expand the days and the hours.
COVID-19 has forced a lot of healthcare professionals into some kind of form of virtual care, and that is certainly a factor in Niagara Health. Can you comment on how virtual care is working in the hospital system?
Yeah, COVID-19 spiraled us to do a number of things. A big one was, how can we provide care differently to ensure that people are safe and that we don't have to have people come into the hospital itself. So that kind of made us jump forward with virtual care. We were doing some virtual care, Mike. The numbers of patients that we're seeing through video conferencing and by telephone has gone up a fair amount. So as an example, in our cancer center in the clinic itself, we were seeing around 500 patients per week. Now we're seeing 100 patients per week that actually have to come in for a visit, and the other 400 we're seeing virtually on virtual care, if you will, video conferencing and telephone. And we actually had an article on our website this week on an 80-year-old lady who's been taken care of by virtual care and is working very well, and she was very, very thankful for that and not having to come into the hospital. Another area from a virtual care perspective is our mental health and addictions program has really been a leader in adopting this. As you know, a lot of the mental health and addictions patients are outpatients, and so we had to close all of our outpatient work. And so the mental health and addictions team have done a fantastic job of keeping those patients engaged and reaching out to those patients, making sure that those patients are getting the consultations and the conversations that they need. Any diagnostic testing that can be done in the community, we're making sure that it's done in the community. Now, if you need an X-ray or an ultrasound or a CT scan or an MRI, if it's something you have to come to the hospital for, then for sure we'll bring you in and get it done. Otherwise, any other diagnostic testing that can be done in the community is done in the community, and then the tests are shared through a joint IT system.
Thanks again, Derek. It's always a pleasure to catch up with you. I know that you have some much deserved time off coming up next week. We'll check in with you again in 2 weeks' time.